Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamai, the natural nurse who will help you take the leap to ultimate wellness.
Greetings, and thank you so much for joining me, Ellen Kamai, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. Today, we are so pleased to have as our guest Dr. James Greenblatt. He is the medical director of Psychiatry Redefined and TZ Health. Dr. James Greenblatt is a pioneer in the field of functional and integrative medicine. He's board certified in both child and adult psychiatrist, and he has treated patients since 1988. After receiving his medical degree and completing his psychiatry residency at George Washington University, Dr. Greenblatt completed a fellowship in child and adolescent psychiatry at Johns Hopkins Medical School. And he currently serves as the Chief Medical Officer at Walden Behavioral Care in Massachusetts. Thank you so much for joining us today, Dr. Greenblatt.
My pleasure speaking with you again.
Now, obviously, just looking at that little tiny piece of your bio, you have been highly trained in what we will call conventional medicine, yet you do functional and integrative medicine. So how did you go from one to the other?
Well, actually went to medical school, interested in nutrition and integrative medicine. So I've kind of kept both tracks and was able to utilize both because I do believe they're complementary. And I think over the last 10 years, the scientific research has caught up. So now it's much easier to combine or integrate the conventional models with our integrative models.
I actually so much agree. And I think that is actually so strongly true in terms of if you do evidence-based good medicine, looking for the techniques and interventions that give you, well, let's say the best bang for your buck, but not just money-wise. I mean, in terms of the lowest amount of adverse effects and the most efficacious therapies, then there is no space because it is the functional and integrative approach that is clearly defined as the best according to research. So what I'd really like to see happen is for there be a reformatting of where the best good medicine techniques are standard of practice.
Absolutely. I think many people are sharing, I used to have a slide years ago where we can't use the word alternative medicine anymore. It's just good medicine.
But however, as we both know, although that's true, where is the resistance? Because that's not what you're seeing in the field.
Well, things are changing, so I'm hopeful. And the research is actually driving that change as we're beginning to understand the research about the gut, and we're beginning to understand and be much more open to looking at nutrition, particularly in psychiatry, for the role of nutrition. Now, it hasn't translated into clinical practice as much as you and I would like, but I think it's getting closer.
Well, I'm glad that I'm so happy to see that you actually feel positively about that. I sometimes feel frustrated because I have clients who, not only in psychiatry, but of course that's your specialty, all kinds of interventions. When they are opening in the hospitals, I know this is off track, but we'll get your comment. And this is true for psychological issues, which of course have skyrocketed since COVID. When you're walking into a hospital and the first thing you see is a McDonald's as the food offering in the lounge when you walk into a hospital, to me, that's a disconnect.
Absolutely. We have a lot of work to do. And certainly the role of nutrition and lifestyle is just very scattered in our medical community. And part of it's driven by lack of education, for medical training and it always comes down to finances.
Yeah, I know. And I actually find it a little bit more than that, because the finances, it's not more expensive to offer better food, really. But of course, it has to do a lot with politics and connections for sure. But have you found that, is that true in your practice, and you've been doing this a lot of years, that the restrictions of COVID have actually seemed to increase psychiatric and psychological challenges?
Dramatically, and research to support it across all major psychiatric illnesses, eating disorders, waiting lists for hospitals, kids. It's just been really a tragic time for mental health care, and COVID certainly has brought that into a different dimension.
And how have you seen that manifest?
The hospital that I work at, focusing on the treatment of eating disorders, we have now long waiting lists for people to get in, calls from parents waiting 3 to 6 months to see a child therapist, 6 to 12 months to see a child psychiatrist. It's a crisis of care is a term we've been using, that why we have to make pretty dramatic changes in our healthcare system for treating mental illness.
So how is that going to be implemented, do you think, or how could it be implemented?
Well, I don't have great hopes for our current system, but if we kind of flipped it on its head and focused on an integrative functional approach, then we have models of prevention. We could look at vitamin D levels a year or two before someone becomes depressed. We can look at other markers that we know are associated with mental health challenges before they become problematic. I believe the only real thing is prevention.
That's such a good recommendation. I think that's something that should be initiated today in every doctor's office. I don't know where the holdup is about that, but maybe it has to do with insurance and drug companies. But why aren't we testing, which is very inexpensive, just a baseline of nutrient levels in everybody? For instance, if you find low B vitamins and treat it with increased foods that have B vitamins and a very inexpensive nutritional supplement with B vitamins, you may be able to offset the development of a severe neurological problem such as MS.
We have research of, without even testing, B vitamins preventing onset of cognitive decline. So the research is there. It's pulling it together and making it clinically relevant and helping doctors understand.
Right. So it's not expensive. It's probably something about insurance not wanting to pay for that testing. I don't know. But it's actually not even expensive out of pocket. Not everybody could afford it, but a lot of people could. I just think it should be such a major focus, something that's so easy, both to implement for the amount, and it's non-invasive. It's not an X-ray. It's not surgical. It's just madness to me that it is not part of mainstream.
Yes, it's both frightening and concerning as the mental health epidemic, for lack of a better word, just continues to spiral out of control.
It is so sad because even my little granddaughter, she's 6, and she had a lot of trauma in her younger years. She's only 6, but very, very intense, in and out of domestic violence, homeless shelters, and things like that. So recently we had her evaluated and we got some help in terms of home visits for her getting therapy, and really was helping. But then they're only allowed to do 8 weeks. So trying to find a replacement person has been impossible.
I can imagine. It's just challenging, very challenging.
So what kind of testing do you do to look for nutrient levels in your clients?
I think there are routine blood tests that we explore with all of our patients. Some of the nutritional values, like simple ones like iron, but vitamin D, B12. And then we kind of explore hormones. We look at genetic vulnerabilities, and we look at other tests that we know might be associated with mental health problems. We want to make sure that we look for the root cause.
So what are some of the tests that would relate to mental health problems?
again, some of the nutritional deficiencies, some of the what we call dysbiosis in the gut, some of the genetic vulnerabilities.
Those are all really well, because I know that I've had several of those tests myself. I just get them regularly. And you already mentioned, Dr. Greenblatt, vitamin D and how that might relate to mental wellness.
Most people don't appreciate that vitamin D is critical for the synthesis of serotonin, a neurotransmitter in the brain that we're talking about for utilizing medications, antidepressants. And without adequate vitamin D, we can't make adequate serotonin, and that affects mood and many other aspects of our health. But people don't talk about the connection between vitamin D and mood.
So what is it? Is there a number that people could look at if they request a test from their own physician that might relate to vitamin D and mood?
People want normal levels of vitamin D. We try to get levels close to 50, 40 to 60. Many individuals, particularly those that are staying inside, using sunscreen, darker skin, just have very low vitamin D levels, and it has profound implications for mental health.
Well, I would like to reintroduce you and tell our listeners that you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamai, the natural nurse at naturalnurse.com. And my guest today is Dr. James Greenblatt, who is a psychiatrist. We're very fortunate to have him on board. And so interesting that he is a psychiatrist who also looks at nutrition. And I believe, Dr. Greenblatt, you mentioned you were kind of a nutritionist or interested in nutrition before you even became a psychiatrist.
Yeah, I've always been fascinated with the role of nutrition and health, and particularly nutrition and brain health, and then just really devastated in medical school when I realized no physician gets training in nutrition.
Isn't that amazing? Now, you were inducted into the Orthomolecular Hall of Fame in 2017 at the International Society of Orthomolecular Medicine. And I'd like to tell you, I was the head nurse for 23 years for a psychiatrist. Her name is Dr. Serafina Corsello. And she is one of the founding fathers or mothers, albeit, of the Orthomolecular Medicine Society. So,
great.
That's exactly how she practiced.
No, it is just, again, logical and very much is made huge differences in people around the globe, but often ignored by our traditional mental health practitioners.
Now, tell us about Psychiatry Redefined, and also how people can find you beyond today's show. And we will have that listed in your bio on the archives as well.
Yeah, Psychiatry Redefined was just an effort to educate all practitioners, doctors, naturopaths, psychologists, social workers, anybody working in behavioral health, to understand these clinical programs around integrative and functional medicine. So how to, interpret vitamin D and B12 levels, how to look at some of these tests. So it's an online training program. There's courses, there's fellowships, there's intensive, there's lots of free content. There's something for everyone to help learn some of this material that's not taught in traditional schools.
Yeah, that's excellent. And one thing, let's say, everything is a double-edged sword, wouldn't you say, Dr. Greenblatt? And as terrible as the whole lockdown and the whole, various kinds of challenges due to COVID and even whatever we're calling this period of time post-COVID, and now there's monkeys, viruses. I mean, it seems to be an ongoing issue with promulgating fear. But one of the things I think that's very positive is the increase in availability of telemedicine.
Absolutely has helped because there are limited functional doctors, particularly trained in mental health. So that telehealth kind of component helps us reach more individuals in areas where there are not doctors trained in this. So it has been an incredibly helpful tool for functional medicine psychiatrists.
So let's say someone hears today's show and they said, wow, they would like to be your client. Is that something that you can do, virtually?
Well, at this point, I'm not taking patients.
Okay.
We, focus on educating and training clinicians, but we do have a referral network. So, on Psychiatry Redefined, they can let us know where they live, and we'll see if we can find a practitioner trained in this program.
Well, let's talk about something that I know that you're well versed in, and not everyone is. And that's something called lithium. Because lithium, I think it's recognized as a drug in psychiatry, but not necessarily understood as also a nutrient.
Yeah, lithium is a mineral. It's in the Earth's crust, just like, iron and selenium and magnesium. And we need a lithium to survive. And there's been just kind of a fear because when people use the word lithium, they think of a drug, and there are side effects to the drug. But the mineral has been what I've been studying for 30 years, and this mineral is essential for healthy brain function.
So is that one of the things that people could get a level evaluated by a blood test?
Blood tests are not going to help at this point because there shouldn't be any lithium in the blood. But we look at other kinds of testing, particularly hair testing, can show lithium levels. And based on clinical symptoms, family history, and these hair tests, we can determine if someone might need more lithium.
So it's something that you would look for, or would you, just try it and see how well it works with a person?
Certainly at low doses, the amount that, you would get naturally can be used for many symptoms. The most common symptom that lithium is helpful for is irritability.
So I know when we were at Dr. Corsello's, and this is quite a while ago, like I said, it was really in the 80s when we had our centers. We had two centers, the Corsello Centers for Complementary Medicine, one in Manhattan on the corner of 57th and 7th, right next to Carnegie Hall. That's because Dr. Corsello was an avid classical music and opera attendee. So that's why she had her office right next door so we could run over there after hours of work. And then we had one in Huntington, Long Island. So it was quite a large operation. And every single thing she did was within the realms of holistic, but very based also in conventional testing modalities. And she used to use lithium orotate as the kind of lithium if she chose to use it.
Yes, that is the most common form that you can get over the counter, lithium orotate. And the medication forms are lithium carbonate. Any form of lithium can be helpful, but the lower doses tend to have no side effects and tremendous therapeutic potential.
So it sounds like, is it almost the same thing if you're using it as a nutrient or as a drug? No, it's very different. The nutrient at very low dosages has kind of natural health consequences affecting genes and kind of antioxidant in the brain and neuroregenerative. It can heal the brain. So we use it in everything from head trauma to dementia. But what the medication does is a much more significant effect on brain function, and it can stabilize mood for bipolar disorder, but it is more likely to cause side effects. Well, that usually makes sense. Absolutely. Are there any foods that if somebody wanted to see if they could increase their lithium levels that might be useful?
It is in lots of grains, and there's thyme. The herb thyme is reported to have the highest concentration of lithium. So it's small amounts in our food, but the reality is most of the lithium we get from our diet is in our tap water because it leaches from the Earth's crust into the water supply. And as we all know, no one's drinking tap water, everyone's drinking bottled water. And I believe that's part of
if you can afford it, and then there's a consciousness about how much plastic you're getting. I mean, I just saw a special on PBS the other day where they were evaluating how much plastic there is, both in drinking water from the tap, which might have all other chemicals in it, as you're saying, but there's much more plastic in people's systems who are drinking water in plastic bottles.
Right. Absolutely. So it is challenging. And that's why, we recommend lithium supplementation at these 1 to 2 milligrams a day.
Oh, so that would be a pretty low dose, but it would be every day or just a few times a week?
It depends on the age and the problem, but a couple of milligrams every day is pretty physiological, and that's what we're recommending.
So I know that you have a little saying about the Goldilocks principle in terms of dosing. What does that mean? Well,
as we're discussing, I think it's clear the research is very significant over many, many years that low-dose lithium decreases suicide risk. Low-dose lithium decrease Alzheimer's risk. And but high-dose lithium has side effects, and significant side effects. We're affecting the kidney and the thyroid. And so it has to be monitored closely if someone's taking medication. So we are always looking for that right amount. And it might differ for different individuals. Someone who has a family history of depression or suicide or substance abuse in their family might need a slightly higher dose than someone who doesn't.
Well, that makes sense. And would someone need to speak to a knowledgeable psychologist or psychiatrist to estimate or guesstimate about how much they might use, or is the 1 milligram amount safe for most people?
I believe the 1 to 2 milligrams is completely safe. Again, it's physiological. But, if someone's taking higher doses than that, they should speak with a professional who can guide them as to the right dose.
So how does lithium work to protect the brain?
Well, I've been studying this for 30 years, and every week we find new research and articles. The list is endless. But some of the things, it affects neurotransmitters. It affects the genetics of some of the peptides that help repair the brain. It affects what's called the chemical messengers that help the brain function more efficiently. The mechanisms of action of lithium is really very fascinating, very complicated, but it's being discovered, and scientists are now fascinated with the potential for utilizing lithium compounds for treatment.
And also, you talk about things like memory, Alzheimer's. Now, what about Alzheimer's and just dementia? Where do we draw the line between those two?
Well, I think so much of the research is just combining the bigger context of dementia with Alzheimer's being a specific one. But the research is quite clear that even people that took pharmaceutical doses of lithium had lower doses of Alzheimer's, that the water supply, higher amounts of lithium, lower doses of Alzheimer's. And, there was an international study over a number of years looking at very low dose lithium as preventing the cognitive decline, not Alzheimer's, but early cognitive decline. Giving lithium for a couple of years prevented the deterioration of this decline.
So that sounds pretty powerful for something that's, not too expensive. And as you're indicating, with a very low incidence of any kind of negative effects in these low doses. So it seems like it's something that, should be included.
Absolutely, particularly with the failure of the pharmaceutical industry and the billions of dollars that are being wasted. As you read the lithium literature, it's overwhelming that we have something that can help prevent cognitive decline with no side effects that are not being both utilized more.
And that's what Dr. Corsello said, so many years ago. And that's why she actually formatted the Orthomolecular Society, Psychiatric Society, because she felt that so much could be done, like you have been researching, in terms of mental wellness and nutrition.
Yes, the connection exists on every level: common sense, science, and clinical, utility. And it's just a matter of helping kind of turn this conventional psychiatry model around, focus primarily on medication as the only tool in our psychiatrist toolbox. And I'm not against medicine, but it should not be the only tool that we use.
I really think that's the best approach, because that's what we get to with good medicine. We don't want to throw good medicines away or surgery. You're not going to fix a cleft lip with herbs and nutrients. We need all that, but it's like a continuum of care where we can use those things which are very easy to use, that have a very low incidence of adverse effects of any kind first, and then moving forward into things that might be more aggressive, and also thinking about using some of strong medications in most cases for short periods of time, not you go on each one for life, which is how they have it now.
Absolutely. There is tremendous possibilities to improving the lives of many, many patients.
Well, in our as we go off here, Dr. Greenblatt, just tell me about TZ Health. It says you're the medical director of TZ Health.
Yes, TZ Health is a clinical program we're developing so we can consult to doctors if they have patients that they don't know functional medicine for psychiatry. So it's just providing clinical, mostly consultation to doctors to help support more patients around the country.
Well, that is excellent. I want to thank you so much for being our guest today, right here on Herbally Yours.
Thank you for having me. Keep up the good work.
And thank you, listeners, for tuning in once again to Herbally Yours. We are produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamai, the Natural Nurse. You can find me at naturalnurse.com, and I invite you to join us next week for another edition of Herbally Yours. Until then, stay healthy.